We are just a few days from Thanksgiving. With rising coronavirus numbers, we all need to be careful. So in today's To Your Well-Being, what you need to do now for a safer Thanksgiving later this week. Family medicine physician Dr. Zoe Stallings is with primary care at Pomona, a member of Cone Health Medical Group. So we're going to just start with this. Okay, given the high number of COVID-19 cases, should people be reconsidering their plans to gather with others for Thanksgiving?
Absolutely. We're encouraging patients to stay home. We talk as always about staying in your bubble. The people you live with are safe to be around, but we don't want you to visit. We don't want you to congregate. We don't want you to use this time like we normally do. We have to revise our approaches because the numbers are increasing every single day. And this is still a disease that takes lives. People die from this. So think about different ways that you can get together through technology. But physically being with each other in each other's homes or going to multiple homes is a very dangerous thing to do, and we advise against it.
All right, so how about then we do the other side?
The other
What
thing
is recommended?
There is a recommendation that we keep things small. So if you have to get together, small numbers, try to limit how many people who don't live in your household from being around you and wearing your mask. I always want to show, again, the demonstration of covering the nose and the mouth, putting that behind your ear and covering your mouth and nose. If you're around people and your nose is still out, you're still not wearing that mask correctly. So if you have to be with each other and you have to visit, let's say it's the only time you have off that you have to see your great aunt, stay outside. You can talk to them on the porch. If you have to eat with other people, we advise that one person do the cooking and wear a mask the whole time and not congregate in the kitchen. We also want people to think about using those outdoor spaces, taking turns, but we just don't want that large gathering.
And we just heard the forecast that it's supposed to rain a little bit in the morning and that everybody should kind of slide things to the end. So maybe you tell people, hey, you come a little bit later on so everybody's not in the house for as long. All right. So if you do decide to have people at the home who don't live there, besides maybe, delaying that, what other steps should be taken to reduce the spread of COVID-19?
So one of the things that we would recommend is washing your hands. So anyone who comes into the home needs to wash their hands. We want to see the proper washing, so 20 seconds or the happy birthday song, using soap and water or using hand sanitizer. The other thing about when people come in, if they don't live with you, for instance, if a really close family friend comes over, is to think about spacing. We can still maintain some social distancing, so we don't have to sit right next to each other. And as we take off our masks to eat, then we really want to think about maybe even angling ourselves away, making it quick so that we just grab a bite to eat, or wrapping up your food and eating it at a later time so that you can spend time together but not necessarily eat together. The thing is, it's more about for people, it's the emotional bonding, and we can do that in several ways. But at this point, if someone comes over, the first step they need to do is washing your hands. So it would be great to put a hand sanitizer right at the entrance. The next thing is, if you're going to eat and share food, making sure that the people preparing the food are free of any symptoms, making sure that people are wearing their masks while they're cooking. And then if someone's getting a plate to go, wrapping that plate up and eating it elsewhere is still advised.
All right, so let's say, because this has been going around with a lot of families, if all the guests quarantined for 14 days before Thanksgiving, do you still need to observe the 3 W's if you did that quarantine thing for 2 weeks?
So a lot of people have asked me that as well at work. And the thought is that it reduces the chance. However, there is still a risk because not everyone will show symptoms. So even if you're quarantined, you could have that disease and not know it. So the virus could still be in your system. And so we still want you to take those precautions. Some people have said, I'm going to take a test and then quarantine. And that's probably the best that we could probably say in terms of safety, is then to say, okay, now I can go visit those who are immunocompromised or sicker and highest risk. But there's still no guarantees. And so the best we can do is limiting our exposure, so quarantining. And for some people, especially if they have, college kids coming back home, those children will probably need to take a test and quarantine if the test is available. Also think about where you are. If you're in a part of North Carolina where you don't have that much access, and you're going to go visit, you really want to make sure you're not bringing something to a region where their numbers and their health system cannot support somebody being this sick. So think about where you're going, think about quarantining. I think that's a great idea to do, but we can't guarantee that that would be safest.
All right, so what steps should you be following for safe travels? Do you need to, some say, quarantine 14 days after you return home?
Now, once again, it depends on where you've gone. So let's say you have traveled to an area that the numbers are skyrocketing, and you are coming back in your line of work or who you live with, those people are highest at risk. So we do want you to quarantine. Some people, when they're returning from travel, they're also taking a test to see what their exposure was. While you're traveling, you should still be washing your hands, wearing your mask at all times, limiting touching your face, making sure that when you're on a bus, a plane, or in the car, to make sure that you keep your mask on. And if you're on something like a plane, you really want to think about all the other risk factors, such as, dehydration. So we want you to think about hydrating before you start your travel plan. Once you get back home, we still have drive-up testing available. So you can also check on Cone Health and see online what the locations are, and you can go ahead and get a test. And then we do want you to talk to your employer. Some employers need a negative test before you return to work. Other employers want you to quarantine, and doing the right thing by your family members as well. If you have visited someone and you're coming back home, letting them know that you've recently traveled and limiting exposing people at home. So keep those tips in mind.
All right, and if you're hosting Thanksgiving, you're the one, it's at your house, do you need to quarantine for 14 days after everyone leaves?
That's a very good question. So if you're the one hosting people and you've done your best to limit, because still want you to limit how many people are coming through, but you may see those out-of-town visitors. We still want you to definitely quarantine because you have been exposed. And if there's a test available, to go ahead and take advantage of that. But it would be advisable to also quarantine and monitor your symptoms to see, but it doesn't mean that no symptoms does not mean you don't have the disease, but it gives you more time to pick up on any symptoms that could occur, leading you to make a decision about what next.
All right, so Black Friday is coming up right after Thanksgiving. I'm one of those who enjoys being up at 4 o'clock in the morning and throwing a few elbows here and there. Just a confession. Thoughts on Black Friday shopping?
Well, I'm like you. I'm one of those people, I historically charge the doors. I really enjoy the thrill of it. And what we're advising is that we want you to still support our local retailers, but try to do those shopping trips safely. So think about the time of day that you go, making sure you wear your mask. Keep a properly fitted mask on the whole time. Many of the retailers are also putting markers on the ground to make sure that there's 6 feet of separation, wiping off the shopping cart, and many of our retailers are making a great effort of cleaning those down. But also think about the space that you're in. If you can shop online, you can order ahead and just pick up at the curb. That's another way to stay safe. And a lot of retailers are extending the shopping. You don't have to cram it all in on Friday. The sales are continuing throughout the weekend and even into next week. So our recommendation is, if this is a tradition that you normally enjoyed with family, you can still do so, but just be a little bit smarter about it, in that limit the amount of trips you're taking so that you really know where you're going. Have an organized plan. Keep your hand sanitizer in a bottle with you. Bring an extra mask. What if you're in one of the stores and the little earpiece snaps off? You don't want to be without a mask. So I usually say bring another 2 or 3 in case the one you're using is soiled while you're doing that heavy shopping.
Just in case it gets crazy. All right. Dr. Stallings will be with us until 6 o'clock answering your coronavirus questions. You can text her your questions. The number is 336-379-5775. We'll be right back.